An email with instructions and a link to complete your medical history on one medical passport will be sent 1 to 2 weeks prior to the date of your procedure. As a general rule, you should not eat or drink 8 hours before surgery. In some cases, you may be allowed to drink clear liquids up to a few hours before your anesthesia. Not being able to have a sip of water or coffee may seem strict, but this decreases the risk of problems such as vomiting during surgery. Leave anything that is important to you at home. Your personal belongings, such as wallet, phone, and purse, will be stored and kept safe while in surgery and then brought to you once you are done. Wear and bring only what you need the day of surgery and after. Clothing should be loose-fitting, comfortable, and appropriate for wearing after the procedure you will be having. Please do not wear any jewelry, including wedding rings and body jewelry. After you've checked in, a member of our clinical team will escort you back to one of our patient pre-op phase. This is an area where you will be prepared for surgery. Our clinical staff, including nurses, anesthesiology, and a surgeon, will speak with you. After you've seen the nurse, changed, and started your preparations, you may be allowed a family member or significant other with you until you are taken back to the operating room. Once it is time for your surgery to begin, you will be brought back to the operating room by your circulating nurse, the nurse that's in charge of your operating room, and the anesthesiologist. The nurse will help you move onto the operating table, which will feel hard and sometimes cold. You may notice bright lights, instruments, and the entire room/area is extremely clean. We call it sterile. You will notice that the operating room team members all wear masks on their faces to keep the room free of germs. There are always at least 4 people that will be in the operating room if you are having surgery under anesthesia: the surgeon, the anesthesiologist, the circulating nurse, and the surgical scrub tech. Some surgeons also work with a physician's assistant who helps the surgeon with certain parts of the surgical procedure.